Hi everyone, I'm Maida, and welcome to Project Lifeline, a program all about bringing simple, life-saving healthcare knowledge to our communities. Sometimes it's not easy to get into a clinic right away, but knowing how to clean and cover a cut and stop bleeding, or keep things sterile can make a big difference for you or for someone nearby. Today, we're going to learn what goes inside a first aid kit and how to use each item safely, and you'll even get to build your own kit as we go. Step 1 is having clean hands. Before you touch any wound or bandage, always start by cleaning your hands. Squeeze a small drop, about the size of a dime, onto your palm. And then rub your hands together, getting between your fingers and around your thumbs until they feel dry. Clean hands help stop infection before it starts. Step 2 is cleaning wipes. If you don't have hand sanitizer, you can use a hand cleansing wipe instead. These can also clean dirt or sweat from your skin before treating a cut. This is how you open it, pull out the wipe, and gently clean your hands or the area you'll be working on. Always make sure to throw the wipe away after using. Step 3 is adhesive bandages. These are great for small cuts, scrapes, or blisters. Make sure to open one up, clean the area, and peel off the back. Place the pad right over the cut and make sure that you don't touch it. And press down on the sticky sides. If the bandage gets dirty or wet, make sure to change it out. Step 4 is butterfly closures. These are butterfly closures. They're special bandages that pull the skin on a small cut together. They help it close up faster. Peel off one side, stick it down, then gently pull the other side across the wound and stick it too. The middle part should be right over the cut, just like a bridge. Step 5, alcohol prep pads. Before you put on any bandage, it's important to clean the wound. That's where the alcohol prep pads come in. Open the packet, unfold the pad, and then wipe gently around the cut. Not right on it, so it doesn't sting too much. Let it dry for a few seconds. The next step is triple antibiotic ointment. After cleaning the wound, you can add a thin layer of antibiotic ointment to help the wound heal faster and prevent infection. You just open it, squeeze a tiny bit onto your finger, just a small dab, about the size of a grain of rice, and then you just cover it with a bandage or a pad. Step 7 is a non-stick/sterile pad. Pads are for bigger cuts, scrapes, or burns. Sterile pads are for cleaning and covering. Gently clean the area with a sterile pad, dry it, and then place the non-stick pad on top. These pads don't stick to wounds, which makes changing them much easier and less painful. Step 8 is paper tape. Use this to hold the pad in place. Tear off short strips, just enough to tape down the pad. You don't want it too tight, you just want it secure. The next step are disposable gloves. They protect both you and the person you're helping. Put them on before cleaning the wound or touching blood. After you're done, peel one glove off inside out and then pull the other one off the same way so that they both end up inside out. Throw them away after one use. Never reuse the gloves. Step 10 is Vaseline or petroleum jelly. These help with dry or irritated skin. If you have small scrapes that are already healing or skin that cracks easily, petroleum jelly can protect it and help it heal. Use a thin layer, not too much. It can trap heat or dirt. The next item is an instant cold compressed ice pack, which is helpful for injuries like sprains, bumps, swelling, or minor bruises. First, take it out of the package and activate it by squeezing or shaking it, which breaks the inner pouch and makes the pack cold. Once you start feeling it getting cold, wrap it in a cloth towel or a paper towel before placing it on the skin. This protects the skin from getting too cold. Scenario. Scenario 1. A small cut on your wrist. First, clean your hands with hand sanitizer to ensure that it doesn't get infected. Next, dab on antibiotic ointment using a paper towel. Then, cover the cut with a small bandage to ensure it heals properly. And then you're all set. And that's your Project Lifeline finished first aid kit. It may look small, but every item inside has a purpose: to protect, to clean, and to heal. Knowing how to use what's in here means that you can help yourself or someone else in a moment that really matters. That's what Project Lifeline is all about: keeping our communities safe, prepared, and cared for. Thank you for building your kit with me today. You're now part of the Lifeline.